Check the vital signs of the patient in preparation to the initial assessment. Apply aseptic technique in hand washing before assessing the patient. Sir, we'll be doing special test to you for me to know the right therapeutic exercise for your condition. Test for neurologic involvement. Slump test. The patient sits on the examining table and is asked to slump so that the spine flexes and the shoulders sag forward while the examiner holds the chin and head erect. The patient is asked if any symptoms are produced. If no symptoms are produced, the examiner flexes the patient's neck and holds the head down and shoulders slumped to see if symptoms are produced. If no symptoms are produced, the examiner passively extends one of the patient's knees to see if symptoms are produced. If no symptoms are produced, the examiner then passively dorsiflexes the foot of the same leg to see if symptoms are produced. The process is repeated with the other leg. Symptoms of sciatic pain or reproduction of the patient's symptoms indicates a positive test, implicating impingement of the dura and spinal cord or nerve roots. Significance of the test. To get response, pathological neurological symptoms such as shooting pain, numbness or burning down into the lower limb. Upper limb neurodynamic tension test. Patient is supine, with their side being tested at the edge of the table. Examiner applies a depressive force to the patient's affected shoulder. With examiner's other hand, hold the patient's wrist and abduct their affected humerus to 90 degrees. Examiner slowly flexes patient's elbow, then supinate their forearm. Examiner slowly extend patient's wrist and fingers and deviate the wrist to the radial side. Recurrence of their shoulder and arm pain, numbness, tingling, indicates a positive test. Significance. Designed to put stress on the ulnar nerve and nerve root C8 and T1. Thoracic outlet syndrome. Adson maneuver. This test is probably one of the most common methods of testing for thoracic outlet syndrome reported in the literature. The examiner locates the radial pulse. The patient's head is rotated to face the test shoulder. The patient then extends the head while the examiner laterally rotates and extends the patient's shoulder. The patient is instructed to take a deep breath and hold it. A disappearance of the pulse indicates a positive test. Significance. Testing the entrapment of brachial plexus between the anterior and middle scalene muscles which form the posterior scalene port. Costoclavicular syndrome. The examiner palpates the radial pulse and then draws the patient's shoulder down and back. A positive test is indicated by an absence of the pulse and implies possible thoracic outlet syndrome, costoclavicular syndrome. This test is particularly effective in patients who complain of symptoms while wearing a backpack or heavy coat. Significance. Testing the entrapment of brachial plexus. Cyriax release test. Procedure. The patient is sitting with elbows flexed. The examiner stands behind the patient and grasps under the patient's forearms while the patient's forearms, wrists, and hands are in neutral. The examiner then leans the patient's trunk backwards about 15°, and lifts the patient's shoulder girdle to end range, holding the position for 3 minutes. The production of symptoms or the disappearance of neurological signs, release phenomenon, indicates a positive test. Significance. Releasing of the tension of the brachial plexus. Halstead maneuver. Procedure. The examiner finds the radial pulse and applies a downward traction on the test extremity while the patient's neck is hyperextended and the head is rotated to the opposite side. Absence or disappearance of a pulse indicates a positive test for thoracic outlet syndrome. Significance. Testing the entrapment of brachial plexus. Ruse test. Procedure. The patient stands and abducts the arms to 90 degrees, laterally rotates the shoulder, and flexes the elbows to 90 degrees so that the elbows are slightly behind the frontal plane. The patient then opens and closes the hands slowly for 3 minutes. If the patient is unable to keep the arms in the starting position for 3 minutes or suffers ischemic pain, heaviness or profound weakness of the arm, or numbness and tingling of the hand during the 3 minutes, the test is considered positive for thoracic outlet syndrome on the affected side. Minor fatigue and distress are considered negative tests. Significance. Testing all 3 intervals where the brachial plexus is passing through. Right test. Having the patient take a breath or rotating or extending the head and neck may have an additional effect. The pulse is palpated for differences. This test is used to detect compression in the costoclavicular space and is similar to the costoclavicular syndrome test. Wright advocated hyperabducting the arm so that the hand is brought over the head with the elbow and arm in the coronal plane with the shoulder laterally rotated. He advocated doing the test in the sitting and then the supine positions. The pulse disappearance indicates a positive test result for thoracic outlet syndrome. Significance. This test is used to detect compression in the costoclavicular space.